accomplished personality in honor is honor for us. Now I request Dr. Partha Sarathi, Associate Professor, Department of Medicine, JSPS Homeopathic Government Medical College, and also the Drug Inspector, President of IHP Greater Hyderabad.
That a solid stool will be considered as melena, but in 95% of the cases, melena is only liquidy, black, foul-smelling stool. The occult bleeding, this indicates bleeding which patient cannot notice, and it will be seen without symptoms. So, what is the difference between upper GI and lower GI bleed? For clinical perspective, the anatomical cutoff of upper GI and lower GI is ligament of Treitz, which is in the fourth.
It's my immense pleasure this evening to invite our second speaker, sir, who has a clinical experience of more than 30 years in the field of homeopathy. Today, as he shares his experiences and clinical tips, I am sure that it is going to help us immensely in our clinical practice. And we are eagerly waiting to hear you, sir.
My dear gracious doctors and respected Parsadi Garu and my friend Mahesh Pagadala, Dr. Dheeraj and Gayatri Devi, Rangnath Garu. On behalf of ISP Greater Hyderabad, we would like to express my sincere appreciation to all the doctors who are here. It's my pleasure to witness the beautiful moments in the presence of you all. It's our privilege to be associated with our Ashtar. Also, I would like to extend my sincere appreciation to Dr. Dheeraj Garu for his CME program today. This program is not only meaningful, it is informative, impressive, impactful, truly understandable also. Your experience and also your presentation was evident in this presentation. I am confident that even this is knowledgeable insights spread by our speaker really will have a long-lasting impact in our practice. Thank you once again for your valuable contribution to our homeopathic fraternity also. So we look forward to hear once again in future also. On behalf of ASP Greater Hyderabad, I would like to expect to make this EMG program successful, and your participation and contribution have played a vital role in our program. So thank you once again. And today, I would like to share some clinical tips on pathological prescriptions of homeopathy. Predictive, whatever it may be. We need patients. He wants only relief only to the patient. That is our motto only. Whether it is pathology, whatever it is. Pathology also plays very important role in homeopathy, because when you read the materia medica and you study the toxicological effects of the substances, if you know the toxicological substances, really that helps you a lot in our practice, because you should have command on medicine. Medicine is very important in our practice, because pathology also covers the patient and also it gives important rubric for the selection of the drug. For example, bryonia affects the serous mucous membranes. So serous mucous membranes means maybe on lungs or pericardium or peritoneum. So mucous membranes involvement is more in bryonia effect. If you give the drug bryonia without any hesitation, you will going to stop further. Abuse the drug in COVID because I use it in my practice. Really, it is a clinically verified drug in any pleurisy cases, pneumonia cases, and also other cases also, and where lungs are involved, and pericardium and peritoneum. These three, the affinity of bryonia shows on this membranes only. Second drug is what we are using, most abused drug in our practice, also Rustex. Rust acts on, it acts on fibrous tissues, ligaments and joints. So most of the cases, whatever it may be, whether it is arthritis, rheumatoid arthritis, polyarthritis, fibromyalgia case, really you depend on rust acts that you can will meticulously just in our practice. Third, coming to the colisynth. Colisynth acts on intestines. So that definitely shows on intestines simply. So it acts like as an antispasmodic drug. GA cases, whether it is diverticulitis, appendicitis, or cholelithiasis, or any IBS, even ulcerative colitis, pain is the most prominent symptom in that disorder. So you give colisynth blindly, really that going to help you a lot in your practice. These drugs are clinically verified in my practice for the past 30 years. It's not a generalized drugs because I am using these drugs regularly in practice without any case taking also. Just within 1 minute, 2 minutes only, I am prescribing these drugs to my patients. Successfully, I am getting good results. So, nuts already you know that it is had an affinity in gastric disturbances only. So, in IBS cases and colitis cases, dysentery cases, Nux is a wonderful drug. Just you go very blindly without any other doubts also. Whatever we are using in our practice, Calibec is the most important drug. Really, Calibec acts, it's a commonest symptom is a profuse, sticky, transparent discharge and sticky sputum is there. It has affinity that on tracheal secretions. Even one of the survey, they found that Calibec is a significant effect on the tracheal secretions. That is randomized placebo control study. Even Calibec, if you are using in ICU patients, when critical care patients are there, when the patient is more prone to this type of secretions, there you give 4 pellets of Calibec on his mouth beside the endotracheal tube. Really, it was like anything. It's a magic remedy. Even I tried in so many patients in my clinic, to my patients also in ICU patients, because they are depending on me. Next, coming to the drug, hepasulf. Hepasulf also acts as suspicious. When the suspicious cases response with hepasulf after Calibec. But only the problem in sepsis case also, when patient complains shortness of breath, chest congestion, when there is elevated BP, when the SpO2 saturation levels are very low, 60 to 80, like that if he maintains, then you can give hepasulf real to my patients. So confidently you can give hepasulf drug in ICU. When there is increase of ESR is more than 100, when there is symptoms of inflammatory symptoms are there, just you give Mexab like 200 potency. Really, that is very meticulous that we're going to result in our practice. Also, I proved in my practice. I treated thousands of cases in my clinic. So, next drug is antimars. Antimars is nothing but is a bronchodilator in homeopathy, like derifilin and decadron injections. So, if you give arsenic antimars, really that gives a lot of relief to the patient. In most of the patients in my clinic also, even without taking derifilin decadron, they are coming to my clinic. Sir, medicine is the child, notla veste child, tagipotundi. That confidence I developed in my clinic. Even when I was in Bharatnari colony, I treated thousands of cases. Even in 100 patients in daily means 80 to 90% patients that comes only for allergic cases only. I gained popularity reputation through allergy. Just 4 to 5 cases only. HIV, hepatitis B, cancer, ortho problems, and hepatitis B. This 5 only I am treating now. But only the problem, even this arsenic antimars, both are bronchodilators. So you can use without any symptoms also. Even if you are blind, if you are not having taken any case taking also, just after coming to the patient to your clinic, just you ask these complaints. What is your problem? I am suffering from asthmatic asthma, sir, or allergic rhinitis, sir, or congestion. Just you give arsenic, then antimars. These drugs are really a magic class in our homeopathy. Then coming to the Silesia, it also acts on the mucous membranes. So in fungal sinusitis, Silesia acts like anything. Fungal sinusitis. So Silesia is the drug for, it is boon to for our patients, really speaking, for fungal sinusitis. So Calibec, Silesia, baselinum, and Imexa. These 4 drugs are really useful in for sinusitis cases. These drugs also common drugs only. And come to the most, this type of case, what we are, GI bleeding. GI bleeding cases also, you can use commonest drugs. Number 1, phosphorus, arsenical. Second, ipecac. Fourth, Candroga mother tincture. Hydroxys mother tincture also helpful in these cases. If patient complains in rectal cancer, if he complains very severe pain is his severe pain means, then you give in your clinic only that will going to relieve the symptoms immediately. But the painkiller is in cancerous cases, give Simsifuga and Colocin. This mother tincture also acts like anything in these cases. If you combine Colocin and this one, really that was well. Simsifuga plus Colocin mother tincture combination in rectal cancers or in intestinal cancers also. That really, I treated so many cases in my clinic. That is the main issues. Part of the tongue with the pain and difficulty in chewing from 6 months. Complaint start 5.5 years back only as a small whitish plaque over the left side of the tongue. Chronic habit of chewing tobacco and smoking is there. Patient considered allopathic doctors, excision biopsy done and diagnosed as a squamous cell carcinoma. And they advised radiotherapy and surgery also. He underwent partial vasectomy and radiotherapy. After 2 years, he developed ulcer on the same side. Then he took biopsy, diagnosed recurrence of squamous cell carcinoma. Again underwent surgery and radiotherapy. From 6 months again on same area he developed ulcer with pain while chewing and swallowing. Then he consulted allopathic physician. This time he was not willing for surgery, as so he consulted. Gradually pain increased, especially on the chewing and swallowing food. Pain spread to lower jaw. So on the basis of pathology, malignant ulcers, mouth, arse, laxus and phosphorus, I prescribed arse first time. After reparation also, I got same drugs only. Before treatment, this patient carcinoma of squamous cell carcinoma of the tongue after 6 months of treatment. See. No evidence of malignancy.
TV advertisement, Dr.Madhu Varanasi, and I asked him, sir, I have a problem of CSM. He suggested me to come with all your reports, then I will suggest you. Then I came to Mr. Madhu Varanasi. He advised me. He gave me the treatment very well. Now I have no problem. But in the year of 2019, same I got ulcer. Same type of ulcer. Again, they suspected the same problem. Suspected same. But my surgeon, Dr. Bandari, is sent for biopsy. But the report is no evidence of malignancy. So I am very much satisfied with Madhu Varanasi treatment.
Even the third time also they are doing same surgery only. After they detect cancer carcinoma only. Then you came to me and you are taking treatment continuously. Since how many years?
7 years.
No, 7 years over.
No,
This is the latest report. They are diagnosis. Now you are feeling okay, na? Okay. There is no symptoms, no pain, no pain. Everything okay.
ఫస్ట్ కనిపించినప్పుడు వచ్చామండి. వస్తే డాక్టర్ గారు మెడిసిన్ ఇచ్చారు. ఆ మెడిసిన్తో తొందరగా క్యూర్ అయింది. మళ్ళీ ఎక్కడ సర్జరీ చేయాలేమో అని భయపడ్డాము. తర్వాత మాకు అది తొందరగా తక్కువైపోయింది. ఇప్పుడు ఎక్కడ నాకు మా వారికి వైపు కనిపిస్తే అసలు భయం వేయట్లేదు. దేవుడి దయతోని ఆ మెడిసిన్ ఉంది అనే ధైర్యం ఉంది మాకు. చాలా భయపడిపోయాను నేను. మా పిల్లలందరూ ఏం కాదు ధైర్యం చెప్పినా కానీ డాక్టర్ మెడిసిన్ వాడగానే 1 వీక్లోనే మాకు రిపోర్ట్ కనిపించింది. మీకు అప్పటి నుండి ఎక్కువ భయం కనిపించినా నాకు అసలు ధైర్యం ఈ మెడిసిన్ ఉంది అని ధైర్యం దేవుడు లాగా.
In some cases where beyond our homeopathy method, we have clinical and surgical, where you have to identify that. When it is really surgical, it is out of our hands. Yes, they are the people, our big brothers. They will take care about it. So medicine is there to save the humanity. So let us take such situations and opportunities what we will be having such type of, again CMEs will be carrying on with forward with in future also. So IHP is doing a wonderful job. I really congratulate and appreciate the efforts which has been done by IHP Greater Hyderabad, all the team. So that's a wonderful job you have done. And thank you for inviting me for this CMA program. Thank you.
Happy birthday on behalf of Greater Hyderabad, IHP Greater Hyderabad.
కేక్ బాగుందంటే హ్యాపీ బర్త్డే
థ్యాంక్ యూ.